So hopefully you'll see at the top of the screen now that the meeting is being recorded. So I don't want this to make any of you camera shy. What will happen is after the session, we tend to share these sessions on our social media platforms just for any customers that can't attend, or if you want to look back on any of the points that were discussed as well, it's really useful for you to be able to do that. So what will happen after the session is I will just edit out. If any of you choose to have your cameras on, I'll edit any of you out. So just to introduce myself for any of you that haven't met me before, my name is Laura and I'm joined today with Holly, and we're going to be taking you through the session today. We've also got some special guests with us today who have kindly joined the session to help support some of the conversations that will be taking place later on. So we've got Sunil from Yardley Green Medical and we've got Kate from Surrey Lodge Practice. And they're attending today because they're two practices that are already using a total triage approach and they're using it very successfully. So they're here to sort of share their experiences with you, how they went about implementation, and they're there for any questions that you might have throughout the session as well. So we'll be speaking to Sunil and Kate a little bit later on in the session. We also have some of the Silicon Practice team on board today as well. So some of them are just observing the session and some of them will be supporting again in the chat as well. So if you have any questions throughout while either Holly or I are talking, please just use the chat. So you'll have a team of people in the chat to speak to you as well. So if you've been to one of our Espresso webinars before, you'll be aware we tend to run them monthly, although we haven't run one for a couple of months now. But for any newcomers, these sessions are usually monthly. They're usually topic based on topics that other practices choose, or where we have like a new feature or release going out that we want to be able to demonstrate to our customers as well. So they're short 1 hour sessions for you to come and just get what you want out of the session. We have quite a lot of open conversation on these sessions, so please feel free, like I said, to use the chat. And when we get to the open discussion later, come forward with your questions, join in the conversation. We just ask that you use the hands up feature just to tell us that you want to get involved and come forward with any topics that you want to discuss, just so we can kind of form some order of how we let people come on. So it's really important to us that we get the participation from you so that you can get the full benefit of being in this session. You get what you came for. So encourage the use of coming off your mics as much as you like to. Otherwise, as I said, just use the chat. So let's get started then. So on the menu today, so if you this is probably appropriate as well, we're doing it over lunchtime, so I'm sure a few of you have got your sandwiches with you. So as well as what you might have for lunch, we've got a total triage overview. So we'll be talking you just a brief overview of total triage and what that means. How FootFall can help with total triage, including a snapshot of some of the latest developments that we've been working on, so you get a sneaky peek of some of the exciting things that we're working on in the background. We'll then hear from Kate and Sunil, who are using total triage in their practice at the moment, so you can ask them any questions that you might like to ask. And then we have the opportunity for some open discussion at the end of the session as well, where you can ask any questions before we wrap up for the session for today. So what I'd like to do as well, we tend to do this at the start of our sessions, is if you have any specific requirements or objectives that you want to get from this session today, to just type it in the chat to us now. And that can just allow me and Holly to just make sure that we're covering off everything that you want to get out of the session today. So feel free to do that now in the chat. And okay, let's get going. So the reason why we decided to do this session today is because we understand that general practice has become very overwhelming for you with the rise in workload, the staffing issues that you're facing, which are likely to be intensified as we move into the winter months as well. So you get staff absences, obviously your appointment levels start to go up. So a good way of being able to sort of alleviate some of these pressures and handle your patient requests that are coming through is to adopt a total triage approach. So we wanted to try and support and encourage some of our customers to move to this way of working. Sorry, if you've just joined us, pop your microphones on mute just for a moment while we're going through the presentation. That would be great. Thank you very much. Yeah, so we're just trying to encourage some of our customers that perhaps haven't had a chance to move to this way of working to do it and to try and give you some discussion and tools to be able to do that. So this, what you can see on the presentation, is an interesting statistic that we found in the NHS triage guide. So I'm not sure if you would have, maybe some of you have seen it, maybe some of you haven't, but it's actually a really good document that gives you lots of useful hints and tips on how to be able to adopt this way of working. So what we'll do is we'll include it in the post-session email after, just in case you haven't seen it. And that will really help you out. So yeah, this is a really interesting statistic that we came across in that guide. We thought it would open the session up quite well. Okay, so another one then for your participation, just pop in the chat if you have any concerns about Total Triage. So perhaps a reason why maybe you haven't moved to this way of working, any concerns, challenges or worries that you have about Total Triage, just let us know by typing a message in the chat, and we'll see if we can overcome some of these during today's session. So while you're sending those through, I'm just going to hand over to Holly, who's going to give a quick overview of Total Triage.
Thanks, Laura. Hi, everyone. So as you know, Laura's just discussed briefly, Total Triage basically means that every patient who contacts the practice first provides some kind of information on the reasons for their contact, so that they can be triaged before they make an appointment. So it's possible to do that entirely by telephone or by walk-in appointments, but using an online consultation system like FootFall is likely to be much more efficient for practices. So Total Triage has become more important over the last couple of years to help to reduce avoidable footfall in the practice and to protect patients and staff from the risk of infection. So for upcoming things, especially like COVID as well. So what you'll see on the slide at the moment is a diagram that just represents the recommended model for practices to adopt. So it basically enables patient requests to enter through a single workflow, which you can see on the left, and that can be managed and triaged by the practice in the most appropriate way. So that includes non-digital users who aren't able to or don't want to use the online method. So they can be supported by a family member or a carer, and that will be recorded by proxy on the request. So they'll have the ability to put in proxy information for patients, or the patient can be taken through the same online form by the admin staff at the practice over the telephone or in person using the patient forms option, which I'm sure some of you have already used already. But if not, it basically allows practice staff to input the same data that a patient would on the website themselves, but they're doing it on behalf of the patient. So practices can then prioritise the care based on the need rather than on a first come, first served basis. And that approach helps to ensure the equity of access for digital and non-digital users. So it can also free up the phone lines for those who can't or choose not to go online. And because digital channels are an additional way of supporting patients, they should really be used to supplement traditional models of care delivery and providing increased choice for patients in how they interact with their general practice. So in kind of broader speaking terms, how can you use FootFall to support Total Triage? And what we're going to look at in the next slide is answering that question. So what we often find with new customers is that the idea of Total Triage, as well as implementing the new website and the new software into the practice, can sound really overwhelming. And obviously that scenario might be familiar to you if you've recently upgraded or you've gone live with FootFall, or you're someone who's been with us for a long time. You may look back and remember the process of going live, and the thought of going with a brand new website, having all this new software and everything is quite daunting. So some of our practices do stick to their usual way of working, but they just kind of integrate FootFall into their current processes, which is fine because FootFall is a flexible product that can do that, but it's been designed with Total Triage in mind, and it works really well for practices who use it in that way. So FootFall supports the Total Triage approach in many ways. So it means that staff can work from home securely where needed using a whitelisted IP address or a practice VPN. Some of you might already do this, but it just means that staff members can work from home and in the knowledge that they're accessing the dashboard securely because it's been restricted to the IP address. Practice staff and patients can send documents to and from each other entirely online. So that reduces the need for walk-ins, for admin-based stuff like registrations and sick notes. practice staff can triage other forms of communication into the dashboard on behalf of patients who call or have accessibility issues. So like we were talking about earlier with the patient forms, if the patient doesn't have an email or a phone number, for example, practice staff can still triage them online using the patient forms model. Requests can be forwarded from the dashboard into your clinical system and saved into the patient record. And the website provides a platform for patients to explore and see what they can do online instead of calling or making an appointment. So you can advertise what patients' options are rather than just expecting them to kind of figure it out on their own. You can say, you know, what are the most common queries that we receive? How can we advertise that on the website and encourage patients to use the website to answer their questions? So I'm just going to hand back over to Laura briefly to go through the next slide for us.
Yeah, so as I said at the start of the session, I was going to discuss a couple of new things that we've been working on. It's really exciting stuff. So we have been working on new developments that will further support and enhance the way that Total Triage works. And one of which is a project that we've been working on closely with our customers, and we would invite you to get involved with that. Anyone who's on the call today, we will invite you to get involved with that as well. So this is to develop the patient-facing side of FootFall, so the website, because we recognise the patient side of FootFall is important, and it's important to achieve a consistent patient journey as a part of Total Triage as well. It's important that we educate patients. So I've noticed a couple of things come up in the chat there that saying patients don't particularly like it. We're getting that feedback and we're listening. So we want to be able to educate patients to how their requests are handled. I think they feel sometimes that they're just sort of pushed online. You may well be getting these repeat episodes coming through as well. So we're listening to all of this feedback that's happening, and we feel like it's important that we educate our patients on how Total Triage works as well, so they understand the point of the triage system is as well. And we also want to make sure that you as the practices are receiving the correct information. So again, some of the feedback that we've heard from you is that patients just aren't finding the right forms for the right problems. If it's an admin request, it's coming on a clinical form or vice versa. So we want to make sure that the practices are receiving the right information in the first instance when the patient submits their request. So this is a project that we've been working on, and we're working on implementing some really quick fixes, which we'll show you shortly. And then we're working on the bigger side of the project, which is kind of like the evolution of the front end. What is that going to look like in the future? So these changes are something we're hoping to be able to offer as part of our next release. And I will hand over to Laurie, our technical editor, in just a moment to take you through what we've done so far on that, just so you can have a sneak peek. But the second thing that we've been working on, and probably the one that you've all been waiting for, is the upcoming release of FootFall version 6. So again, this further supports that Total Triage approach. Version 6 offers many enhancements and features that will allow triage to become more efficient and more manageable in the practices. So we're going to show you a quick snapshot of what some of those features look like. Now, I don't want to go into too much detail on the version 6 dashboard today, because that's not what we're here for. We're here to talk about Total Triage. But I just want to point out that we are hosting 2 webinars again next week, which will go through the version 6 dashboard in detail. So we'll post a link to those webinars so that you're able to come on and attend those next week. But yeah, we will go into more detail about that then, but we just want to highlight some of those features and what they look like to you today. I know as well that many of you will be really keen to know when this is all available, because it's really exciting stuff. But at the moment, the development plan is to have a practice from each area pilot these changes. Then once we've kind of got a sign off and approval from those practices, we can start to roll it out across the area. The exact detail of what that will look like is to be defined, as there's still a lot to do. There's lots of different things that we need to consider, such as forms changing, and it all takes a little bit of time to do. So this is something that will probably need to happen in stages, and it's why we can't really give you a definitive date just yet. So I'm just going to hand over to our lovely Laurie now, who's going to just show you the front end of FootFall, what we've been doing on that. Over to you, Laurie.
Thanks, Laura. Hi, everyone. I'm just going to share my screen. Can everybody see the display of the evolution practice?
Yeah, I can see that.
Yeah, brilliant. So the Evolution of FootFall is an ongoing project created to explore ideas for a better front end to FootFall. We wanted to gather feedback and set up a user group to look at how we can make FootFall easier to use for patients and practices. We are currently in the prototyping and feedback stage where we're using a patient and practice feedback to evolve the FootFall product. As you can see in the first prototype edition, things may look similar but ever so slightly different. We are still working on this, and as it is an ongoing project, we are completing this with our user group. I'll show you a few of the changes we have on our evolution practice. One of the changes is we have updated the names of each of the rooms and added a description underneath to explain more clearly what the room is and what it contains. Each description consists of a list of either the most commonly used forms or information pages. We are also working on a set of quick links. So these change the functionality of the rooms when the patient is navigating it. Each option in the description list will now take the patient directly to a form or page. So if they were to click on register as a new patient from the room, it will take them directly to the form. This works the same for pages as well, such as your opening hours. Patients can also access the room in the same way as before, just by selecting the room name or the and more link, and this will take them in so they can view the current state of the rooms. We've also put a lot of focus on the current consulting room, now appointments. This room now serves a more specific purpose. We have added more information about the Get Help for Any Health Problem form in the first column. One of the main changes here, we've created an FAQ for patients about the system and how the triaging of forms works within the practice. So this gives the patient the option to read through any of the questions they may have about why they should use the system and how it will work. The last sneak peek here within our evolution practice is our new smarter routine appointments form. So this form will dynamically change depending on the patient's desired routine appointments. Within this column, you have 5 bullet points, each of which contains a link which will tailor the form depending on what they select. So for example here, this will change the form to a request a blood pressure check appointment and will fill in the required appointment there. This is the same for each of the options, and this will tailor the one form into what is required, and it will also ask any relevant questions to do with that appointment. We've selected the most commonly used based on the feedback from our user group for the time being. This may change in future. If the patient selects the other routine appointments option, they will be taken to the original form where they can either select from the list or select another option there to fill in what they may need as a routine appointment. This makes it easier for the patient and the practice to know the exact appointment that they are booking. We are still making changes and gathering feedback with our user group. So if this is something that you would like to be a part of, please register your interest in the chat and we will be in touch with more details. Thank you.
Thank you, Laurie. That was great. Yeah, so as Laurie said, we do have a user group already involved with that, but we would like to offer you the opportunity to be involved at this stage as well. So I think probably in the next couple of weeks there will be another user group meeting where again more prototypes will be reviewed. Also, any of the developments that have happened since the last user group meeting based on their feedback. That would have been taken into consideration, and then any further developments from that will be reviewed at that stage as well. So if this is something that you would like to be involved in, please just send us in a quick message in the chat just saying I would like to be involved, and then we'll keep a record of that and we can ping you a message after the session today on how you can get involved in the future meetings to do with that. But yeah, thanks very much, Laurie. So now what we're going to do is just hand over to Holly, who's just going to show you the new version 6 dashboard. And remember, we're just showing you a sneak peek of some of the features that are going to really help you with Total Triage moving forward.
Thanks, Laura. So I'm going to share my screen and hopefully you'll all be able to see that okay. Is that okay? Can you all see that?
Yep.
Perfect, thank you. So this is a sneak peek of version 6, as Laura said. So we're just going to look at some of the features that will help you to kind of adopt a total triage model, essentially. So what this does is it allows more control over different types of requests, how you see and how you triage them. So one of the main things is the work list has changed. So we now have a way for you to kind of decide between whether you're working through what kind of queries. So brand new queries and queries that have been replied to by patients are now separated into different lists. So you'll be able to see anything that's an ongoing conversation as opposed to something that's just been updated and something that's brand new from the patient. And you'll also be able to filter by things like breached alerts. So you can just work through the list of things that are priority because they've breached a KPI. You'll also be able to look at things that have been assigned to and by you as normal. There are things like filters. So you can decide if you're working through a list of queries, you can decide what kind of query you need to work through, if there's a particular type, or for example, who the query's been assigned to or from, or you can filter by different kinds of alerts on the dashboard as well. And you can also change how you view the dashboard, which will allow you to change how quickly things can be triaged. So you have this default view, which is kind of like listing all of the requests as normal. Up here on the right hand side, you can see you can swap over to what we call card view. And this allows any staff members of the practice who are using the dashboard to go in and work through a long list of queries and assign them to people quickly without having to click into each individual request. So when you're in card view, you can see each individual query and there's an icon here. If you click on it, it will show you a preview of the content of that query, but you're just viewing it as a preview rather than going into a new page. And if you scroll down, you'll be able to actually assign it quickly. So if you're working through a list as a member of staff who is triaging queries, you can just use this card view, go into preview each query, quickly assign it to who it needs to go to. And then on top of that as well, things can be changed, like the status of a query can be changed whilst you're in card view. If I pin a request, like here, I've just clicked on this little pin icon and it's allowed me to then make changes to it without going into the query itself, so I don't have to leave the page. So I can move it to parked or waiting or close it. I can change the priority. Again, I can assign it as well. So there's lots of scope for being able to quickly triage through a list of queries based on different criteria, the priority of that request, what kind of request it is, and all that kind of helpful stuff. So the other thing that you can do is connect the dashboard will have much more integration into the clinical system. So it will basically be, it's not on this demo because it's not technically a live site, so we don't have any live clinical systems to connect it into. But if I go back to the regular view of the dashboard, I'll show you a request that I submitted earlier. So I put this information in, and basically on the right hand side, you can see here that it's come up with my information. The only thing that I, as the patient, entered into the form were my name, date of birth, gender and email address. And then it's come up with everything out of the NHS database or the PDS, Patient Demographics Service. So every registered patient will be on that database. And then because the dashboard can connect into that clinical system and into that database, any patient that submits a query via the dashboard can be verified, and then it will show their registered practice and their NHS number automatically. So you can see here that I've been verified as a patient. So you'll have access to that information. You'll know where the patient's registered, if they're actually one of your patients or not. And because it's integrated into the clinical system, it means that you'll be able to quickly and easily forward all of your requests into either EMIS or System 1 using a button here. And obviously at the moment it's saying System 1, but if you're an EMIS practice, it will have EMIS instead. You'll be able to forward all the information in the query directly into the patient record, and it will code anything that can be coded. And you can also change how and what gets coded. So you can pick and choose what parts of a request go in, if you need some bits of information and not others, for example. And you can set that up as a default or do it ad hoc for each different type of request. So there's lots and lots of more features to help you to quickly triage requests, you know, and also to integrate it into the clinical system a lot more efficiently as well. So just go back to the home page. I think that covers the main parts of it. Did you have anything else that you wanted to add to that, Laura, while we're on the demo? Or
no, I think that's perfect as a little sneaky peek, Holly. As we said, we are going to be hosting Espresso webinars again next week. So I think Wednesday is for EMIS practices, and then the Thursday is for System 1 practices, just because the integration is slightly different. So you'll just need to make a selection based on which clinical system that you use. So we'll make sure that if you haven't already registered for those, that you have the links to register at the end of this session. The sessions will be
in the chat as well. Sorry, just so that you know.
Sorry, Holly.
I just popped the links in the chat a bit earlier.
Brilliant, excellent. Thank you.
If you scroll up in the chat, anyone, you'll be able to see the links for the EMIS one on Wednesday and the System 1 on Thursday.
Yeah, that's great. And those sessions will be recorded as well. So if you can't attend on those days, don't worry. We'll record the sessions and they will go up onto our YouTube channel as well. So I think, you know, that gives you just a flavour of the things that we're working on to help you implement Total Triage into your practice, how we're trying to make it a little bit easier for you and your patients. And now I would like to hand over to our special guests, Sunil and Kate, to just give some ideas of how to implement this, share their journeys to Total Triage in their practice and some of the benefits they've seen. So Kate, are you happy to go first?
Hi.
Oh, yeah.
Can you hear me? Can you see me?
Yeah, I can hear you. Thank you.
Hi everyone. I'm practice manager at Surrey Lodge Group Practice in Manchester, and we've had FootFall as our website for a few years now. But earlier this year, we were really struggling with the number of appointments that the receptionists had to allocate on a daily basis, and it was becoming quite a big problem for us. So, to give you an example, on a Thursday we had 13 clinical sessions, but by 8 minutes past 8 in the morning, all appointments had gone, and the receptionists were batting off calls, just saying, they couldn't really give patients. Well, they had two options: they either put them on the emergency call list, even though they weren't technically an emergency for the on-call GP, or they would just have to tell them to phone back and then have to deal with the same problem again the next day. And it was just becoming really unmanageable and unsafe for our on-call GP. So we took the decision earlier this year, and we've launched FootFall Total Triage back in mid-April. So all patient requests for appointments, nurse appointments, prescriptions, letters, online access, registrations, test requests, fit notes, everything now goes through FootFall. We still have a team of receptionists that will deal with any patients that cannot use the online form, and they will upload the requests for them, and also just frees up our phone lines for those true emergencies and where the receptionist needs to spend time with those patients and put them on the on-call list. So it's worked really well for us. How we implemented it, we basically just closed our appointment book and said that no clinicians are able to pre-book any appointments in, or receptionists, from the day we implemented it. So it was a really clean book. That, there was there was lots of space then, and we've got lots of FootFall slots available. We sent out an MJOG to all our patients, just informing them that this was the way that they were going to need to request an appointment, and we've also put obviously a message on our answer phone. Patients were really receptive to it. We already had over 600 patients a month using FootFall for our prescriptions, so it was quite an easy transition for our patients, because a lot of them were basically were ones that probably wanted to request an appointment. We also set up Accurix for messages for reception to use. So when the patient called in, they just said, well, we can just send you a text message and you can submit your form online. But then they will also submit it for patients too. Our online access, so the appointment request forms, we have put a limit up to on that. And this is the one reason why we did go with FootFall, because we did look at other online triage, but we've got control over when that form is live, so we didn't want our patients to have access to the forms all over the weekend or overnight. We have a lot of mental health patients in our particular area, our patient population, and we wanted them to be able to didn't want to have the on-call doctor having to deal with those on a Monday morning, because it would be too much, it would be too unmanageable. So our form is open from 7:30 till 3 o'clock each day. But obviously our phone lines are open core hours. And it has worked well, and our patients have been really receptive to it. So we are really pleased with how it's gone. We've had a few complaints, but no more than we would get with the fact that we weren't able to offer the appointments that we are able to now. How it works for us, so patients put a request in, and then we have a member of staff who works on our triage, so she's there 8 till 4, so we've got 2 key members of staff that do the triage, and then the rest of the reception team deal with any of the calls coming in. And again, that's really helped, because that administration person can look and manage our flow, and they're responsible for managing the flow throughout the week. So we're finding patients are getting dealt with more on a daily, weekly basis, and that obviously helps them and keeps them happy. The form comes in, and the person who triages it will either ask for more information or photos to be sent in before they allocate it to a clinician, or will allocate it straight away to a clinician. Also, if there's an emergency, they will put it onto the on-call list. And then we download the form in EMIS, so the clinician can use that. We did start by the clinician going on to FootFall and trying to email the patient back. Actually, the feedback we got back from our clinicians is that most of the patient requests some can be dealt with a quick text messages, but once they've got that information, because the triage is so good, they would then call up. But one of the good news is that clinicians can get through more in a routine session, is because they've got more information to start with rather than what was initially put on EMIS. So they would have a lot of information from the patient, they would have some pictures if appropriate too, and so it gives them a bit of a head start before they're phoning the patient, so that works well. We launched in mid-April. We've now got over 1,200 requests coming through for appointments on a monthly basis, which is great, and those patients are all being allocated the correct slots in the correct places. We've got up to about we have some months 3,500 requests coming through, so that's all our admin requests too on top of that. We found it helps streamline our admin team, and also from an audit perspective, requests are generally coming through FootFall, so we're not having to use email and phone, so it's all coming through one central place, so we can really see what our demand is. The routine doctors, as I said, they like it because they are getting to see more information before they actually contact those patients, and then they'll either bring them in for a face-to-face or deal with it over the telephone. And our on-call GP, it is much safer, and we've seen massive benefits. It was unmanageable and unsafe for them, and it's really improved that situation. They can concentrate on the emergencies and their other on-call duties rather than getting everything that couldn't be allocated an appointment. Reception morale has improved too, because they're not having to bat off patients. They used to get quite a lot of abuse on our phone lines because they weren't able to offer an appointment slot. Now they've got lots of options to be able to say to patients, so, well, if you complete this form, you will get dealt with quicker, and that that's what's really helped, and it's gone down really well. And most of our patients do get dealt with the same day or within the same week, so yeah, our experience has been really positive. There are a few things that it would help for us to have the version 6, I think, upgrade. That's going to help because it does take time to go into each request and triage into different areas. So there's a few technical problems, but overall we've been really happy. And I have to say that we like FootFall too, because if we want to make a tweak on the form or we want to make a tweak to our website, you guys are really receptive and you get it done very quickly for us. So it's worked really well for our practice.
Kate, thank you so much. I'm sure everyone found that really insightful, and I'm sure that Kate would be happy for you to type in any questions on the chat if you've got any questions you want to direct at Kate. But we've got to hear from Sunil now as well, who's going to talk about his experience. Thank you, Sunil.
Yeah, hi everyone. We're a general practice based in Birmingham. We have around 11,000 people. We are a diversified practice. Our patient cohort comprises of British, Irish, Arabic, Somali, Urdu, Bangladeshi, and a few other religions, Romanian, and a few others. One of the issues we had was before COVID, we were a walk-in surgery. So every patient in the morning used to stand in the queue and they used to make their appointments and they used to be seen by the doctors and used to go away. So we ended up in changing that, which has been in place for 40 years, to a telephone-only appointment during the COVID time. Most of the patients did not like it. They felt it was an obstacle they cannot reach. Their access is taken out of their hands, and they started actually complaining. And I used to receive around 10 to 12 complaints a day simply about the access. Not even having the appointment, but not able to reach the surgery, come into the surgery and say hello to the reception team. So we implemented FootFall. We actually started doing the pilot from June, and we implemented in the month of July. Over the last 2 months, we have processed 2,300 requests, and some of the reviews that are coming from patients is phenomenal. I think for the first time I have seen 4 5-star Google reviews, which I haven't seen for a while. The way how we do it is we always pair up a couple of admin staff with a couple of clinicians for the day, because our practice is currently receiving around 130 to 140 requests a day. Out of 70% of those requests are clinical requests. The rest are admin requests. So some decisions we have made is we will do a couple of clinicians doing it for half a day at this point of time to triage all these 140 requests. Except unless it is required for a face-to-face consultation, these requests will be closed by the clinicians that have been designated for web triage for the day. So the admin staff will filter the requests, and then by the time the clinicians come for the web triage, they will be allocating the requests to one of those clinicians. So right from sick notes to prescription requests to new patient registrations, all these, the admin staff will be making the background work and will be keeping it ready for the clinicians to review and sign it off for the day. The rest of things we do similar to what Kate's practice is doing. We have, with this over the last 2 months, our duty doctor is smiling. Our staff morale has improved because they used to get battered after 9 o'clock to say that appointments are not there. I think it will be seen as a big cultural change, to be honest, in the beginning, our GP said no to total triage. They said, let's do only the admin requests or the FootFall, take out the clinical requests. But after 45 days, now what they're saying is that this is the best we have done in our surgery's history. That says it all.
Amazing, thank you, Sunil. Has anyone, I haven't seen any messages come through on the chat, but I'm sure if there's anyone that wants to come onto the microphones and ask Sunil and Kate any questions about more about what they've experienced with going Total Triage, how they've done it, then I'm sure they'd be more than willing to answer any questions that you've got.
The chat's open as well, so feel free to send a message on there if you'd like.
Or just pop your hand up if you want to come off your mic and have a chat with everybody. Sure. So when the forms are switched off, do you find patients just call in? I think Kate, was it you that said about switching the forms off?
Yeah, hi, can you hear me?
Yes.
Initially we did see a spike of calls after 3 o'clock, but patients have got used to it now, and reception were just sending that accurate message out just to say the form opens again at 7:30, do complete it because you will get dealt with tomorrow. So it was just building up that patient confidence, but initially we did see a spike, but it's now, phone lines are really manageable and nice and quiet in the afternoon, so bar the emergencies that come through.
Perfect, thank you, Kate. Hopefully that answers your question, Sean. Any more? We've got about 14 minutes of the session left and it's all yours. Whatever you would like to ask. If there's anything specific that you wanted to find out today, now's your chance to ask if we haven't answered it already.
One quick question came back from a PC, and one of the practice managers asked me, by giving a digital access and allowing patients to raise more requests for themselves than required, he asked me to do a quick piece of analysis. On 2,300 requests, we have done analysis, and interestingly we found that only 6 to 7% are actually more than what they require in their contest. So that shows that 93 to 94% of the time patients are coming back with the genuine request.
Brilliant, thank you. Okay, so the chat seems very quiet.
I'm just going back and seeing if there's any questions that we had that came through the chat earlier.
Yeah.
So we did have a couple of comments, one from Terry who said patients don't like it, also concerns about patients without technology. We're a large elderly patient-based practice. And Jill said, we found reception staff completing the forms on behalf of the patients over the phone caused more delays on the telephone. So I don't know if we've answered those questions specifically, but Jill, you've just come back on and said, on the site RE forms, we have to complete the standards. It asks practices what hours patients have access to forms. I'm not sure what you mean by that specifically. Could you let us know? Could you clarify that for us? Sorry, Jill.
Do you have access to a microphone, Jill?
Hi, yeah, sorry. So essentially, I think what they're actually saying is patients should have access to the online forms whenever practices are open. So the core hours 8 till 6:30. And I know most practices like us, we do close the phones off at 4 o'clock because it's just unmanageable. But that is something in addition that's been requested now when practices are having to complete the site rep forms 3 times a week. It's actually asking this information now.
I also have to complete the site rep form in Manchester, and what I put on our online forms are we only restrict access for a few of our online forms, so it's the request an appointment with the nurse and healthcare assistant, and also get help for any health problem and ask reception question. So I put that they are live between 7:30 and 3 every day, but our phone lines are open core hours, so 8 till 6:30. And they've not raised any questions about that, and it works well. I think other practices throughout the country, they can limit, sometimes I think limit even shorter hours than what we do. We did a bit of research. I think a practice in Altrincham, actually where I go, so on a Monday the online forms were only open 9 till 2, whereas for us it does work. It's fine 7:30 till 3, and it gives patients the opportunity before they go to work to submit that form, and they found that really useful as well, to have that bit extra time before 8 o'clock when that mad rush is to always get that appointment. And also the elderly population, they're really most of them are fine now with using the form. My parents live in Surrey, and they submit all their requests. They're in their 70s and put all their requests through to their practice via FootFall. And if our patients are really struggling with language barriers or anything like that, our reception staff will help them. There's, and it doesn't, because the phone lines are a lot freer now than what they were pre-FootFall triage. It really helps. They can spend that time with the patients, so it doesn't clog up the phone lines at all.
Thanks, Kate. So I think that helped to answer the question from before from Terry. So Terry, if you're still there, hopefully that answered your question about having an elderly patient-based practice. So does anyone else have any general concerns about, if you're thinking about adopting a total triage model for your practice, or, just in terms of getting ready for the months ahead, about how you might manage the increase of demand for online services, basically? Does anyone have any kind of other concerns or any questions about how you can use FootFall to maybe help you with that?
Okay, I think Kate and Sunil, thank you so much again for attending today. I think your experiences and the way that you've done things and implemented it has been invaluable to everybody that's here today. So thank you for coming on and explaining that with us and sharing that with us. If you do have any other questions, we will be around for the next 5-10 minutes or so, but no problems, Jill, thank you. Yeah, we'll be around for the next 5-10 minutes or so. So if you do have anything that you want to submit through on the chat, or you want to come off your mic, please feel free to do so. Otherwise, we'll start to just wrap up the session. And we'd just like to thank you again for joining us. Holly has put those links into the chat, but what we'll do is we'll send a post-session email round, just including the links to the Espresso webinars. If you're not already part of our Facebook community page, that is where all of our webinars get announced first. So it's worthwhile joining that Facebook community page. So I think Holly will pop that in the chat, and we'll put that in an email.
Just pop that in there now.
Great, thank you, Holly.
And
then also our YouTube page. So this recording, as I said, once it's edited, will go up onto our YouTube channel next week. And that's pretty much it. So as I said, we'll wrap all of that up into an email for you anyway. We will just hang on for a couple more minutes just to see if we do have any late questions coming in. But otherwise, you are all free to go. And thank you very much for joining us today.